Welcome to a series of interviews with professionals who work closely with the autistic community. While these discussions may cover topics related to learning, medical issues, therapies, and nutrition, all information shared is intended solely as an educational resource. The information presented comes from professionals who share their expertise at their discretion. However, nothing shared in this recording, on print, in meetings, or through this platform should be interpreted as medical or legal advice. Always consult your child's doctor or trusted healthcare professional for guidance tailored to their individual needs. Please note that presentations on this platform are recorded and will be translated for training and educational purposes at our discretion. Dr. Jared Skowron is a leading biomedic physician specializing in non-pharmaceutical therapies for autism and ADHD. With over 21 years of experience, he has dedicated his career to helping children with neurological differences thrive using evidence-based natural approaches. He is the founder of Spectrum Awakening, a company that develops nutritional supplements designed to support language development, behavior, focus, mood, and overall health in children with autism. Dr. Skowron is also the author of the Amazon best-selling book 100 Natural Remedies for Your Child and a recognized expert in biomedical interventions for autism. Let me introduce.
Thank you, Najeli. I'm very excited to be here.
I'm excited too. We've been planning this for a little while. So I wanted to invite you to, and I find that the information that you share is absolutely important, especially because you focus on the very, very beginning steps of what parents need to know. And when a parent is just starting this journey, is absolutely overwhelming.
Yeah, it
So
is. Yeah, you're given the diagnosis and told to go to therapy, but you don't know what else to do, and it's hard to find somebody who has a guide for you and say this is not just selling you, hey, you need to buy this. Here's the plan, here's the road for your child.
right. And that's one of the reasons I started Spectrum Parents Academy, because when I, I'm a chiropractor, I was already interested in autism. But when my child was diagnosed, that was a completely different approach, because now I'm like, okay, what do I do with all of this? And where do I start from school, from the signs that I was seeing. So I absolutely am grateful for your practice and the information that you put out there, and I'm very grateful that you are participating with us. Um, so let's start talking of what's important to remember about autism.
Well, the first thing to understand about autism is it is a medical condition. Autism is not the choice of a child. The child is not choosing to behave badly or not speak or bang their head on the ground. This is not bad parenting. Okay, do not blame yourself for what's going on with your child. This is not, you didn't give them too much television or whatever. It is a medical issue, and with medical issues, there are medical treatments and there's science and there's research. So I want everybody to do as much for their child as possible. It's more than therapy. It's more than, the right school. We need to fix what's inside.
Thank you for saying that, because one of the first things we do is blame ourselves, and it's so not fair. It's a waste of energy. Absolutely. Thank you for saying that.
You know,
So,
you've got enough stress having a child with autism. You don't need more.
and I feel like a lot of the times it's not, this point of view is not really seen. And I have found that a lot of the times, um, the parents adopt this idea of like, let's fix my child.
Mhm.
But what they're not understanding is that it's not that the child needs fixing, but it needs to be supported. And that's what I was so driven to your to your program and the supplements, because he's helping them with the things that they need the most, but
Mhm.
you're not fixing them. It's in a way you're just supporting what they really need, the most of basics.
Right. And some kids who are old enough, don't want to be fixed. They don't feel like there's something wrong. And
Right.
I don't want to make them think, hey, there's something wrong. I want to help them be better. I want to help their brain to work better and their body to work better. I want them happy. And giving them the nutrients and the food that their body needs can help them do that. So we're just helping them help themselves feel better.
Right. um so you talk about three things that we need to focus, and let's talk about it.
Yes. So when I talk to families in my telemedicine practice, I always ask them, what are your goals? What do you want for your child? And there's usually three main answers. They want their children to speak more. We want to know, what is my child thinking or feeling? Are they happy? Are they sad? Are they in pain? Number two, better behavior. So many kids are hyperactive. So many kids have behavior problems at school. Some kids are aggressive or violent. So helping those behaviors be more calm is the second thing. And the third thing, which is what every parent wants, is my child to be independent and safe when we're not around anymore. And every single parent wants that for their kid because they love them.
Absolutely. If we could just have a little bit of language so we can know, like, if they're sick, if they're feeling bad,
Yeah.
like we would be able to do something.
It's
Um,
Yeah, and there's
let's.
there's a lot there's a lot of information online and on the internet, and it gets confusing. So it's really important, if you want to do as much as possible, find an autism doctor to help guide you, to guide you through the medical support, because you may take things that you find on the internet, like probiotics or fish oil or B vitamins, and that actually makes your child worse because it wasn't done in the right order or with the right plan.
I agree with you. We need to find good doctors. And in our program, we are going to we are working on putting information about the doctors that we trust. And you absolutely, we are going to be in there because we need that support. We need that information that is accurate. And they're not just saying, I help autistic child because they want to help their practice grow and not know anything about it.
Yeah, good. That's
So
awesome.
I was really impressed, I have to say,
Mhm.
that you were able to find somebody that your producer of supplements, so you have absolutely control on what's going in each bottle.
Yes. And that was really important for me because, again, I've been in practice for 21 years and been using, vitamins and herbs and natural things the entire time. But I wanted something better for my patients. So that's where Spectrum Awakening came from, 10, no, 11. We're 11 years old now. 11 years ago, I started making my own supplements. So I know exactly what it is, and it's exactly what I want. And it's what helps my patients. And I can make everything gluten free. I can make everything dairy free. And I know it is. And I also try to make a lot of our things as powders because most kids can't swallow pills. So we also need to think about the taste and the texture because our kids are picky eaters, and it needs to get in there. It will work, but we have to get it in.
Yep. One of the things I absolutely love when I order the supplements is even the ones that come in capsules, you can break them up and they don't have, except for one. But then
Wait, which
Ooh,
one? I need to know.
I think one has garlic in it, no? Um,
Which one?
Biocide?
Oh,
Biocide?
biostilin. Yeah. Yeah, that is
But
a
I
you don't like the garlic? The taste?
like the
Yeah. That is a very powerful antimicrobial. And garlic works really well, but some of our pills you have to swallow. Yeah.
yeah.
We
Yeah,
have other
it's
things, but that would
important. We're going on a tangent, but I really want us to focus on the supplements that you have. I have them with me, and I have to say, I have started my son on the protocol.
Mhm.
First, just like getting him to start tasting it. So we when we dive into them, like do it full
Yep.
time. And I feel like that's the approach that we have work on.
The first group, and this is the most important thing. If you have a child with autism, this is the first thing to do, period. Make sure they are pooping everything every day. Okay. I want a big poop every single day. Many of our kids are constipated, and that constipation causes a lot of behavior problems. So you can improve behaviors just by getting them to poop. Some kids have diarrhea, and that diarrhea can come from gut infections, which also cause more problems with behavior. So what I recommend for constipation is magnesium and electrolytes together. We have a
Mhm.
product called Brown Log Train, which is the magnesium and the electrolytes together, and it's the best thing I've ever seen work for constipation. It's amazing.
I don't have it with me. I absolutely love the idea that it's a combination with electrolytes
Mhm.
because a lot of the parents don't know that it's the electrolytes that
Yeah,
help
yeah,
things move.
yeah, exactly. And electrolytes can help the diarrhea as well. They help moderate where the water goes in our poop.
Right.
It can help with both.
So tell me something. How can we tell our child has um um digestive problems?
So there's three major digestive problems that we look for in our patients. Number one is infections. So getting a stool test, looking for bacteria, looking for yeast like candida, looking for parasites. I mean, I had a mom send me a picture of like a 10 centimeter worm in her child's diaper. So these things are in our kids and making behaviors worse. So we can test and get rid of the infections. Number two, we want to make sure your child is digesting their food. If you cannot digest your food, you get a big bloated belly, lots of air. So that can help. Also, kids who are growing slowly physically, kids who are short, kids who are thin, they often need digestive enzymes. And
Okay.
then the third thing we look for is inflammation. And some of our kids have severe inflammation that needs to be addressed. And that's going to affect behavior and mental function as well.
So let's I have seen children with constipation
Mhm.
that are toe walking.
Oh, yeah.
Uh, and it's very interesting to think that it's because of the constipation. And you brought this up to my attention, not because of a neurological
Mhm.
issue.
Right. Yeah, toe walking is common in our kids, and I hate to see doctors recommend surgeries, which they do sometimes. They want to cut the Achilles tendon to stop the toe
Oh,
walking,
yeah.
right? You don't need surgery. You need to understand what your child's feeling. And the more you can understand what your child's feeling, the more you can guess what's happening. When they're screaming, when they're scared, when they're pulling your hair out, understand they're in fear, they're scared. And when they're toe walking, understand that if I have to poop and there's no toilet, oh yeah, I might toe walk as well. Once we get that poop out, they feel relaxed. They can walk normal.
I I have seen it a lot on my child's little friends,
Mhm.
and and I thought it was a neurological issue before listening to you, and now I
Yeah,
can absolutely identify it, and it's heartbreaking because being constipated hurts a lot, and
exactly.
you can
And they
see
cannot
them
tell us.
in a lot of pain.
Yeah, yeah. Especially the kids who are trying to hold it.
Doctor,
They don't want to go. So the second thing you want to do, and we talked about this a little bit as you asked, um, is treating
mm-hmm.
infections in the gut. So we mentioned stool issues and inflammation, digestion, infections. Um, the immune system in the gut of our kids is often very low. And this increases the risk that our kids get infections in the gut that last for weeks or months or years. And this can be infections with yeast like candida, or with mold, or with bacteria or parasites. I mentioned the worm in my patient's diaper. And these infections cause a lot of behavior problems and cause a lot of anger and aggression. So, with my patients, I normally give two things. Number one, something to clean out the the intestines. That can be charcoal, that can be clay, that can be chlorella. There's a lot of different there's a lot of different supplements called binders, which will help clean out the intestine. The second thing to use is something that will kill
Okay,
the infection. And there's a lot of natural things that can kill these infections. There's a lot of pharmaceuticals that can kill these infections. Use as much as possible. I like colloidal silver because it's very effective. There's a lot of
which is
science,
this one?
and it's tasteless. So colloidal silver is tasteless. It tastes like water, and that will help a lot of my patients' behaviors. What I tell my patients is, you give your dog parasite medication so they don't get worms. And whenever I go to eat sushi, I'm eating wasabi so I don't get parasites. So
Right?
it's obviously false because I test for parasites and I see them all the time. But
Right.
if you're not testing, you can't find them. And I think the doctors are trained that America is super clean, and the only time a doctor will test for parasites is if they go to another country. That's
Mm-hmm.
just,
What they say.
other countries are worse. The United States is best. That's the propaganda, and it's stupid. So the third part of our protocol, again, the first part was fix constipation, fix diarrhea. The second part is look for gut infections and remove gut infections because
Uh-huh.
those are going to cause behaviors. The third part of our protocol are different vitamins to help the brain function better so we get more language. And this is this is a protocol of 4 supplements that I call the Skowron solution. And the 4 supplements are going to balance different chemicals in the brain. So the first step, many kids' brains are very hyper. They're going. This is because of a chemical called glutamate, and glutamate is very hyperactive in the brain. So our first supplement reduces glutamate in the brain, making the child calmer. The second part is to increase levels of serotonin in the brain. Serotonin, something you may have heard of. It makes us happy, it makes us calm, it makes us relaxed. But there's a lot of science showing how serotonin is important for language development.
Right.
So our second supplement is called super serotonin. The first one is called anger management. But the more serotonin you can, oh yeah, there it is. That's the anger management, and the serotonin is number 2. There you go. Thank you.
First this,
Yeah,
then this.
exactly. Now you're adding them on. You're not, you're not taking turns. You're going to do them all together. We start one at a time to watch how the child responds, but you're going to be doing all of them simultaneously. So that this more serotonin can help with language a lot. I mean, I've given kids serotonin supplements, and within a month, they have way more words than they used to. So I got a story about that for later.
Yes.
The third step is a vitamin called folinic acid. And folinic acid is probably the most, there it is, the most important vitamin for children with autism. It has the most science, the most research showing how it helps kids' language. Okay. It can cause some kids to be hyperactive or have sleep problems. That's why we start with the first 2 steps. So the first 2 supplements are going to help make the child calmer, so the folinic acid does not make them hyper, which is a common
It kind of counteracts the
Yeah.
folinic acid.
Yeah,
Awesome.
exactly. Yeah. Because I would give folinic acid to kids, and half of them would get hyper and half of them would have sleep problems. So I needed to figure out how to fix that. So I created anger management, which helps reduce those side effects. And the serotonin also helps keep calm as well.
I have, they definitely jump. Their energy changes so much.
It does. Yeah. And certain kids more than others. But yeah.
Yeah. And don't do it for bed either.
Oh, no. That's the morning. That's a morning.
That's a morning. Yeah.
The fourth step and the last one in this part is a supplement that increases dopamine in the brain. Now, dopamine is, and this is our attention on the double supplement. Dopamine is the chemical for focus and concentration. Dopamine is the chemical they treat for ADHD. So we want to make sure we're increasing dopamine for more focus and concentration. Again, yeah, that's the one. Similar to the folinic acid, the attention on the double can make kids hyper. So we definitely do this one last. And of course, in the morning.
Right. And I am very happy to find iron in this supplement.
Yep. Yeah.
Because my child and a lot of the childs that I know are iron deficient.
Yeah.
So we'll have to give more.
Exactly. Yeah. Many kids, anyone who does not eat beef, hamburgers, steak, it will be iron deficient, unless you take a supplement. And many of our kids do not eat beef. So it's nice to have just a little bit of iron, and a little bit of iron is necessary for the dopamine production in the brain. So the body needs iron and vitamin C for this to happen. So we put it all together. I would say I just want to make sure people understand what to expect. Just under the Skowron solution. So when you're giving supplements and natural things to your child, things can get better or things could get worse. There are side effects. This is very common when we're treating the gut. So if you're doing probiotics, you're doing something to kill infections, the behaviors can get worse. And this is because the treatment's working, but the dead infections are not getting out in the poop. And so that's why the first step is always make sure they're pooping. And if you see these behaviors, you can always add more of the binders, the charcoal, the clay, the chlorella we talked about. With those gut treatments, more binders will reduce side effects.
One of the things I always said to my patients, to my clients as a chiropractor, is that healing is not a straight line. Our body needs to adapt to the new things in their body, and a lot of the times is the body reaction is maybe not recognizing it or maybe absorbing even more. So we don't know exactly how the body is going to take these supplements and use them until we have consistency.
Yeah, exactly. So feel free to adjust, feel free to adapt what you're giving your child to what works best for them. Some kids need a little, some kids needs a lot, some kids need this, some kids need that. Adjust based on what works.
Perfect. All right, let's do that. No. Um, a teacher asked this question. As a teacher who spends many hours with children, how can she initiate a conversation with parents about possible vitamins deficiencies and gut related issues?
Now, this is a great question because teachers walk a very fine line where they need to share, what's going on with your child with you. And if there are behavior issues, that's hard for the teachers, that's hard for the school, and hard for you at home. So a teacher may, want to suggest something, but can't cross a line and say, hey, you need some medicine, or you should try this vitamin, or whatever. So what I try to tell teachers or other therapists, speech therapists, occupational therapists, is um, send them to a place that will educate and will teach you. So, for instance, our website on Spectrum Awakening, we have ebooks and we have courses and we have podcasts. We want to teach you what is going on in your child with autism, and there are many solutions and many different natural treatments you can try. But like you said, every child responds to something differently. So it's important for other people working with kids with autism to have a place where they can send parents to learn more.
We are putting a guideline for teachers that can use as a resource that they can share, and it also includes like information about vitamins and stuff, but they can literally give in a page like, here you might want to learn this. That would be awesome.
Yeah.
All right, there's these other questions. um hmm. When parents start to begin to notice early signs of autism,
Hmm.
but maybe they don't even know what autism is.
Hmm.
There's a formal diagnosis, but they're starting to see like, something strange is happening.
Hmm.
Where would we? Where would they start? Where would they? What would be the initial
Right.
things that they can identify?
Okay. So here are some important things. Number one, compare your child to other children. Compare your child's development to other children you have, other sons, other daughters, because most kids should develop at a very similar pace. You can compare them to friends' kids and neighbors of the same age. If you think something is wrong, keep pushing until you get an answer. If your pediatrician dismisses you, if your pediatrician says, he's just a boy. Just wait, he'll be better. There's two languages in the house. These are all things that pediatricians say to dismiss you, and you just lose time helping your child. Okay? Trust your parent instinct. Parents know their children better than anybody else. You know, with appointments with me, people are like, "Well, you're the doctor." I'm like, "Yeah, but you're the parent. You spend 24/7 with your child. I am here to help, but you know them." And here in the United States, there is um, free diagnostic services or free medical services for children under the age of 3. So you don't need your pediatrician to get that. It's called early intervention, and in the United States, each state has a different name for it. But you contact early intervention. You don't need your pediatrician, and you say, "I want an evaluation," and you get it done. Okay, and then you learn more. You know, you come to our Spectrum Awakening website, you watch the podcast, you read the ebooks, and say, "Hey, I need to help my child. Where do I start?" And this is where we start with that 3 steps: the pooping, the behaviors and the gut infections, the brain vitamins for the speech. And then there's plenty more after that. But this is where we start. And find a doctor that specializes in autism.
Great. Absolutely. Great. Thank you. One more question.
Yes.
And this is for parents. Parents, when parents have so much stress,
Mhm.
is there anything that we can do that you will suggest?
Yes, that is a great question because parenthood is stressful in period. And parenthood with a child on the spectrum is even more stressful. So you need to make sure you're keeping it together, and that's hard enough. So number one, try to get as much sleep as possible. You need that to recover. If your child's not sleeping and you're up through the night, it's going to make everybody feel worse. Okay. And number two, you are under a lot of stress, and there are hormones that help you manage stress. And these are going to be affected dramatically under any kind of long-term stress. So this is an adrenal hormone called cortisol. So we want to take adrenal supplements. I use one with my parents called Sanity Saver, and
Mhm.
I used it myself. My daughter was a horrible sleeper, and she didn't sleep through the night till she was 7. So I was on night duty, and I was exhausted and burnt out. And it was adrenal supplements like this that really helped me get through it.
Wow. And I'm really happy that you are also helping parents because this is something that we absolutely need.
Yeah, of
And a lot of the times we put ourselves
course.
very, very last.
Yes.
Yeah.
How many times is my dinner my child's leftovers? Yeah, that's
Yeah,
parent.
absolutely.
So
So you wanted to tell us about some of the cases that you've been working and something that I was really excited to know about.
yeah, it's always fun to hear stories of other families that have been helped. So, um, I want to tell 3 different stories of patients of mine, and just to give you an example of what can happen. So, the
Right.
first story was a little girl, and I was speaking at an autism conference, and a mom came up to me, and she told me about her daughter, who was a 5-year-old daughter, um, who was nonverbal. She didn't have any words for, since she was 1. And I talked to the mom, and I after understanding the child, I said, "I think your child needs that dopamine brain chemical that we talked about, because there's
Mhm.
certain symptoms that I we can see." And so she took the vitamin home, and then 2 days later she came back. She came up to talk to me, and she said, "Today's my birthday." And my daughter, who has not spoken in 3 years, held my face before I left this morning and said, "Happy birthday, Mom." And she hadn't heard words from her daughter in years. And so if we can do that with a vitamin, that's
Oh,
that's amazing. That's amazing. Um,
absolutely.
yeah, it was I teared up that day. Um,
Mm.
second story. Oh yeah, the second story. This is a family I recently saw this year, whose child's behavior was so violent and so aggressive. He got kicked out of multiple schools. The parents have to put a lock on their bedroom door because they're scared that he'll come in the middle of the night and hurt them. And so many of our kids, and this is completely wrong. So many of our kids are put on psych medications. They're put on antidepressants. They're put on antipsychotics to calm their behavior. But that behavior is not their choice. That behavior is not their brain. That behavior is coming from a pain from a gut infection. Okay. So I treated the gut infection as we talked about with a binder supplement and our colloidal silver supplement. And within 3 weeks, his aggression dropped 90%. And the parents were just ecstatic that they didn't need their child on risperidone for 10 years or Lexapro, which causes suicidal ideations in kids. They didn't need psych meds when we fixed the medical cause of their anger. So
Would you come back to us and talk about these medications?
I will come
And,
back
and
and talk anytime you want. Yep, anytime.
awesome, awesome. Well,
Um, yeah, so I'll wrap up with a third story, and this is one of my favorite stories. This is a longtime patient. This is actually twin boys, and I started
cool.
seeing them when they were 5 or 6, and we worked, and we worked, and we worked, and life goes up and down, and journeys with autism, journeys with kids are up and down on a roller coaster. But today,
Mhm.
10 years later, they're 16. They're in mainstream high school. They're doing well academically. They just got their driver's licenses. I talked to their parents. They got driver's licenses. They're going to prom with their girlfriends. They run cross country track and are winning awards. And they are now independent. They are what every parent dreams of, a child who's going to be okay. And it's a long journey. It is not overnight. And that's why I like this story. The story is permanent success, but the story is also, emphasizing it's going to take time. But as long as you're seeing that roller coaster go up, you're on the right track.
This absolutely makes me emotional because I not only like one of the biggest things I wanted to know is like what's gonna happen when he's an adult.
Yeah,
And with our members, the first thing is like I'm just so concerned of what's gonna be his future.
of course. Every parent worries.
Yeah,
Yeah.
yeah. So listening to the story of the twins is absolutely beautiful. Thank you. It's a little sunshine of hope.
We all need that. Any family who wants to learn more, please visit my website, spectrumawakening.com. We have podcasts in Podcast World and YouTube videos and ebooks. We offer lab testing internationally. If you need organic acid tests, stool tests, genetic tests, we have those for you. We have telemedicine appointments with me. We have over 80 different vitamin supplements specifically made for kids on the spectrum, all gluten-free, all dairy-free. We want to help every child in the world on the spectrum. So head to our website, spectrumawakening.com, and thank you for doing everything you can to try to help your child.
Absolutely beautiful. Thank you, Dr. Jared, for coming to the Spectrum Parents Academy. I am really excited to continue working with you. And if you or any of your friends as parents have any questions, please let me know, and we will relay the questions um, to Dr. Jared Skowron.
Thank you. Thanks, Nigeli.
Thank
Thank you for having me.
Parents Academy. En este programa hoy tenemos invitado al doctor Jared Skowron. Y él es un médico biomédico, es el líder en terapias que no incluyen farmacéuticas para el autismo y el TDAH. Con más de 21 años de experiencia, ha dedicado su carrera a ayudar a niños con diferencias neurológicas a desarrollarse mediante enfoques naturales basados en la evidencia. Es el fundador de Spectrum Awakening, una empresa que desarrolla suplementos nutricionales diseñados para apoyar el desarrollo del lenguaje, el comportamiento, la concentración y el estado de ánimo, y la salud general en niños con autismo. El Dr. Skowron también es un autor de best-selling en Amazon, y su libro se llama Los 100 remedios naturales para un niño, y es un experto reconocido en intervenciones biomédicas para el autismo. En esta entrevista abordaremos las preocupaciones médicas que enfrentan muchos padres de niños autistas. Bienvenido, Dr. Jerry.
Bienvenido, Nayeli. Gracias. Hola, mi propósito el día de hoy es darles información que he implementado en mi práctica por más de 20 años, y aunque no hable muy bien el español, y me ayude leyendo una traducción. Les agradezco su paciencia, porque lo que más deseo es poder ayudarlos a ustedes, padres, para que sepan cómo ayudar a sus hijos con autismo.
Muchísimas gracias.
De nada.
Hablemos de lo más importante que necesitamos saber como padres.
Sí, primero, es importante recordar que el autismo es una condición médica. No es una decisión, sí, no es una
¿Decisión?
decisión del niño, ni es causado por una mala crianza. Como con la mayoría de los problemas médicos, la terapia puede ayudar, pero lo que ocurre dentro del cerebro también necesita ser corregido.
Y es importante que sepamos que la, ese comportamiento de los niños tiene una base médica, y me agrada mucho que lo mencione, porque hay mucha información en el internet que es abrumadora.
Sí, cuando hablo con mis pacientes durante las consultas de telemedicina, les pregunto cuáles son sus metas. Las tres metas más comunes que siempre escucho son más lenguaje, mejor comportamiento, independencia para el futuro. Por,
Independencia.
sí, por gran cantidad de información en Internet, es fácil sentirse confundido. La mejor manera de ayudar a su hijo es con la orientación de un médico experto en autismo. Existe un orden correcto para brindar apoyo médico. De lo contrario, el comportamiento puede empeorar. Empeorar.
Empeorar. Ujú.
Empeorar, gracias. Muchas familias observan problemas de conducta al dar probióticos, aceite del pescado o vitaminas del complejo B, sin atender primero los problemas subyacentes.
Subyacentes.
Subyacentes,
Sí.
gracias.
Y
Muchos años es
para aprender el español en pasado.
gracias.
Es importante saber y lo que vamos a hablar en este programa con el doctor es que la mayoría nos va a ayudar a identificar aspectos en los que tenemos que estar muy atentos. Y el primer paso que quiere abordar el doctor es en el problema digestivo. este es un problema muy grande y muchas veces se nos pasa porque pensamos que es algo muy normal que un niño o esté estreñido o tenga diarrea por lo que comió, por si come mucha fruta, uno piensa que tiene diarrea, pero en niños autistas es un gran problema.
Sí, sí, es más importante y el primero por sus hijos. Los niños que caminan de puntitas son hiperactivos, defecan menos de una vez al día o hacen bolitas pequeñas varias veces al día. Usualmente están estreñidos. Correcto. Un momento. Ah,
Estreñidos.
sí. Am, estreñidos. Corregir esto es el primer paso para mejorar el comportamiento. También quiero mencionar que los problemas intestinales pueden manifestarse como diarrea. Y esto también puede afectar el comportamiento. La prioridad es que debemos enfocarnos en ayudar con el estreñimiento. Saque todas las heces de su hijo para mejorar su comportamiento. El magnesio combinado con electrolitos funciona mejor. Nuestro suplemento llamando Brown Log Train que ayuda con esto.
Este suplemento es uno de los pocos que he visto donde hay una combinación de electrolitos con magnesio. Y es muy importante porque los electrolitos son los que ayudan al control del agua, de la humedad en el intestino, y es lo que ayuda a que la popó pase por el intestino. Pero también están los niños más expuestos a infecciones, sobre todo infecciones digestivas. Entonces am, vamos a aprender cómo identificarlas y por qué tenemos que poner atención a esto.
Sí, los niños con autismo son más susceptibles,
Susceptibles, ¿sí?
gracias, a las infecciones intestinales comparados con otros niños. Las infecciones por levaduras, mojo, parásitos o bacterias pueden causar agresión, conductos adolescentes, problemas para dormir e hiperactividad. Tratar estas infecciones mejorará ah,
Ujú.
notablemente el comportamiento de su hijo. Puede usar medicamentos, tratamientos naturales o ambos. Yo utilizo un aglutinante como el carbón vegetal junto con plata coloidal para mis pacientes. Sí, es
¿Ya?
esto.
Y aquí lo tenemos. Esta es una combinación que el doctor ha encontrado, sobre todo la plata coloidal, que ayuda a matar los parásitos y las bacterias. Una reseña que quería hacer es que las levaduras y el mojo, los niños están expuestos hasta en la comida, no solo en factores ambientales. Y parásitos existen en México, aquí en los Estados Unidos, así es que es algo que tienen que buscar un médico que realmente los escuche para poder ayudarlos con con este problema de infecciones intestinales.
Yeah, sí, todo el mundo, parásitos.
El parásito está en todo el mundo. Vamos a hablar sobre el cerebro. Y esto es muy importante porque todos los niños se desarrollan en cierto paso, pero sí, tenemos que enfocarnos por ejemplo, en el lenguaje.
Sí, el desarrollo del lenguaje uh, re- requiere cierta actividad química en el cerebro. Los niños con autismo frecuentemente tienen niveles bajos de ciertos químicos cerebrales como la serotonina. Balancear estos niveles puede ayudar a mejorar el lenguaje. Primero, uh, hablamos del protocolo completo de Skowron. Incluye
Ujú,
los pasos que ya mencionamos, el intestino y el cerebro, pero también como combinaciones
ujú.
lo siento, de 4 productos que yo mismo he desarrollado. Estos productos están diseñados para funcionar en el orden correcto, minimizando efectos secundarios y optimizando resultados. El primer paso es identificar. Muchos niños tienen un cerebro hiperactivo, ¿ok? Y ansioso. Esto
Ya.
puede deberse a un exceso de un estimulante llamado glutamato. En Spectrum Awakening tengo una comisión de vitaminas que se llama Anger Management y tiene vitamina B2, aminoácidos y litio para reducir el glutamato, lo que ayuda a calmar el cerebro del niño. En segundo paso es el enfoque, es el desarrollo, es difícil,
Desarrollo.
desarrollo del habla, lo cual requiere serotonina en el cerebro, que los niveles suelen ser bajos en nuestros niños. El aminoácido 5-HTP,
Muy bien.
gracias. Práctico, práctico, práctico. Um, 5-HTP o triptófano ayuda el cerebro a producir más serotonina, lo que puede mejorar el lenguaje en nuestros niños. Esto también puede ayudarles a dormir mejor. Para ello, tengo un suplemento llamado Super Serotonin.
Y la tenemos aquí. Este es el bote que estoy probando con mi hijo. Am, muy bueno. Vamos a seguir todo el protocolo del doctor,
Ujú,
a aprenderlo y después les doy una revisión de los productos.
perfecto. El tercer paso es uno de los suplementos más importantes para el lenguaje y lo que más se ha investigado científicamente es el ácido folínico. Este está relacionado con el
Gen,
gen,
gen.
MTHFR, sobre el que quizás haya leído en línea, lo siento.
En la línea, en línea.
La línea, ok. Se ha comprobado científicamente que el ácido folínico mejora el habla en nuestros niños. Esta vitamina puede causar hiperactividad o problemas de sueño, por lo que es importante no empezar con el primero, sino usar los 2 primeros suplementos para reducir este riesgo. Para ayudar con esto, elaboró un suplemento llamado ácido superfolínico.
Ujú.
aquí.
Ya lo tenemos. Quiero recalcarles que este protocolo debe de tener una secuencia y esta secuencia es que en esto es los dos primeros suplementos que mencionó el doctor, el de Anger Management y el de Super Serotonin, es para ayudar a calmar al niño para que cuando empiece su cuerpo a tomar el ácido folínico no tenga tanta hiperactividad, porque es muy marcado la hiperactividad que tienen algunos niños, no todos.
Sí.
Y el cuarto paso, doctor.
Sí, en cuarto lugar, nuestros hijos también carecen de concentración y atención. La concentración requiere una sustancia química cerebral llamada dopamina, que suele estar baja en nuestros niños. El aminoácido tirosina ayuda al cerebro a producir más dopamina, lo que puede mejorar la concentración y la atención. Para ayudar con esto, elaboró un suplemento llamado atención al doble.
¿Qué es esta?
Sí. La solución Skowron está diseñada para ser adaptable. ¿Adaptable? Sí, adaptable.
Adaptable.
No todos los niños tienen la misma genética ni responden igual a los tratamientos. Agregue estos suplementos uno a uno y ajustarlos según lo que mejore más a su hijo.
Esta es la sugerencia que les estaba dando cuando empiecen a tomar los suplementos, que se van a ajustar a las necesidades que tienen sus hijos. Doctor, muchas de las cosas que es importante recordar para esto son los problemas gastrointestinales, entonces tenemos que apoyar de cierta forma a los niños para que puedan ayudarse con la concentración, con el lenguaje y estas metas que mencionó mejor. Así es que vamos a seguir adelante y vamos a hablar, am, am, vamos a hablar de esta información con el doctor para que podamos dar una idea de cómo ha ayudado a sus pacientes. Yo sé que quería compartir usted la experiencia que he tenido con sus pacientes. Por ejemplo, de la niña, de los casos que ha tenido, que he visto mucho beneficio. And this is the testimonials that you want to say. Um,
Sí, las tres.
oh, no, wait, the expectations.
Oh, sí, sí.
Expectations.
Ok. Um, Cada niño es diferente, pero muchas familias empiezan a notar mejores en el comportamiento, el lenguaje o el sueño en pocas semanas. Pocas semanas. Es importante seguir el proceso y hacer ajustes según la respuesta del niño. Es importante recordar que al usar tratamientos intestinales, si los comportamientos empeoran, se asume que la infección intestinal es grave. Agregue más aglutinantes como carbón vegetal para ayudar a limpiar el intestino.
Ujú. Esto es muy importante saberlo porque no todos los tratamientos tienen una línea derecha de cómo el cuerpo va a reaccionar con los suplementos. Muchas veces la infección puede estar muchísimo más grave y necesita más cantidad de suplementos. o una forma de ayudarlo es con los aglutinantes, que el doctor mencionó que el carbón ayuda a la eliminación de las toxinas en el intestino, porque se pega a las toxinas y lo saca. Entonces, ah, tiene que, al hacer este tratamiento, tiene que observar cuáles son las necesidades del niño para poder ver, okey, necesita tal vez más, más soporte de intestinal o más soporte de vitaminas.
Ujú. Sí.
Eh,
En las tres. Sí.
Ujú,
Ok. Am, hemos visto resultados increíbles en familias que siguen los pasos cuidadosamente. Desde
ujú.
niños no verbales que comienzan a hablar, hasta niños que duerman toda la noche por primera vez. Estas historias son impactantes. Primero, estaba en una conferencia sobre autismo, hablando con una madre sobre su hija no verbal. Ah, tras, tras enterarme,
Sí,
¿sí?
enterarme.
Enterarme de su hija, supuse que tenía deficiencia de dopamina, basándome en sus síntomas. Le di a la madre mi suplemento, atención el doble, que
Mm,
aumenta la dopamina. Dos
sí,
días después, sí, sí está aquí. 2 días después, la madre sí me acercó llorando y me dijo que hoy era su cumpleaños. Antes de salir de casa para venir a la conferencia, su hija le sujetó la cara con las manos
ujú.
y le
Oh,
dijo, feliz cumpleaños, mamá. Esas fueron sus primeras palabras en 3 años.
wow,
Sí,
wow.
es,
Ya, es muy importante que sepamos qué es lo que
sí,
los beneficios que puede tener estas vitaminas.
sí. Es interesante. um, la dopamina es más fuerte en las hijas
¿No?
y la serotonina,
Vitamina.
serotonina es más fuerte en los hijos.
Ah,
No, no sé por qué.
mm,
Um, but yeah, sí,
sería algo muy bueno de investigarlo. That
sí,
would be really nice to research.
yeah. Ok, el segundo. Una
Ujú,
familia habló conmigo durante una consulta de telemedicina y me explicó que su hijo de 8 años era un desastre. Tres, tres, tres colegios lo
ajá.
habían echado y tenían que cerrar con llave la puerta de su habitación para que no los sorprendiera por la noche y las hiciera daño. Este
Era
comportamiento, oh no,
por
perdón.
agresión,
Sí.
because aggression, yeah.
Sí, sí, por agresión. Um, yes, sí, ¿cómo se dice scared?
Miedo,
Miedo.
miedo, miedo, con D.
Miedo, sí. Um, ya, las parantes, ya.
Ah,
Anyway, este comportamiento agresivo es muy común en las infecciones intestinales. Les di me, les de, lo
D,
siento. Les di me algún tinante intestinal y mi bala de plata coloidal. Estaban
ajá,
muy contentos porque en 2 semanas su comportamiento agresivo se había reducido en una 90% y lo iban de matricular de nuevo en el colegio.
wow. Eh, the agglutinante, the
binder.
What that you use? Is it this one?
No, no. It's llama yeast mold binder o gut binder.
Okay,
Tengo,
okay.
tengo los dos.
Los
Ah,
dos. Junto con
bios,
eso.
sí. Sí, la plata colloidal es similar a otro suplemento, biocilin.
Oh,
Sí, sí,
okay.
sí. Yeah.
Es este o ese, no al mismo tiempo.
No,
Not
no.
the same.
You can do you can use both, but they are similar actions.
Got it.
Yeah.
Okay.
Okay.
Dijo el doctor que se pueden usar los dos, pero la función es la misma. Solo quería traducir that little bit.
Yeah, es mucho. Es mucho. Ah, mi última historia es la más importante. Es agradable ver pequeñas y rápidas mejoras en tu hijo, pero el objetivo más importante es la independencia a largo plazo. Empecé a trabajar con gemelos cuando tenían 6 años. No hablaban, tenían autismo moderado y asistían a una escuela especial para el autismo. Ahora, 10 años después, asisten a una escuela secundaria regular, obtuvieron sus licencias de conducir,
Wow.
son excelentes en los deportes, van al baile de graduación con sus amigas y les va bien académicamente. Oh, es largo.
Académicamente.
Da- académicamente.
You got it. Yeah.
Académicamente.
Yeah.
Yay. Ah, estos niños han pasado de no hablar y de que los médicos les dijeran que estarían en un hogar el resto de sus vidas, a ser adultos independientes. Esto
Wow.
no sucede de la noche a la mañana. No es mágico, pero si ayudas a tu hijo con su especialista en autismo, puedes ayudarlo a recuperarse.
Wow. Wow, doctor. This is incredible. Este es increíble porque y me da mucho gusto que compartiera estas testimoniales con nosotros, porque una de las cosas que no sabemos, sobre todo para mamás que apenas están aprendiendo sobre el autismo, no saben cuáles son no saben lo mucho que pueden lograr los niños autistas si tienen un programa a seguir, si tienen un suplemento, si están ayudados con comportamiento y todo esto. Y esto no es para cambiarlos, sino para ayudarles a que vivan una vida más plena.
Sí.
Ah, quiero hacerle 3 preguntas, three
Ujú,
questions,
ujú,
que hemos tenido en otras entrevistas.
ujú.
Y esta pregunta la hizo una docente, una maestra, que dice que ella pasa muchas horas con los niños, pero se pregunta cómo se puede iniciar una conversación con los padres sobre posibles deficiencias que notan de vitaminas y en problemas intestinales. Es difícil para los maestros.
Sí, es difícil para los maestros dar consejos sobre salud. Lo que puedes sugerir es en base a lo que has visto con otros niños en la clase y dar la referencia sobre Spectrum Awakening, donde pueden aprender esta información.
Muy bien, y me da gusto que mencione su programa porque tiene muchísima información sobre tratamientos y las causas del autismo, y es más fácil mandar a un papá a aprender que darle una recomendación.
Sí, sí.
Ah, la otra pregunta es sobre cómo los padres que comienzan a notar señales tempranas de autismo, aunque no tengan el diagnóstico, ¿cómo, cómo deberían empezar a identificar los problemas y qué preguntas pueden hacer al pediatra en esta etapa?
Bueno, primero, recordemos lo que hablamos en esta entrevista. Es una buena forma de empezar si ya empiezan los niños con signos. Síguenos en Spectrum Awakening y sigue aprendiendo.
Muy bien. Am, es am, a empezar a notar, por ejemplo, los problemas intestinales desde muy pequeños, puede ser el origen del de de que no se sientan bien, de la agresión, de los comportamientos, así es que sí es algo que tienen que poner atención como padres. Y la última pregunta que quiero hacerle al doctor
Ujú,
es que, ¿qué recomienda para los papás?
ujú.
Porque el cuidar de un niño autista requiere de mucha energía,
Oh,
y quiero ver, qué pueden hacer los papás para que pongan atención a sí mismos y se enfoquen en las necesidades que también tienen.
ujú, sí. Primero, trata de dormir los más que puedas. Y segundo,
Ujú.
soporte suprarrenal. Tenemos un suplemento en que el enfoque es ayudar con el estrés. Um, nuestros es llamados Sanity Saver.
Sanity Saver es el suplemento que tienen para adultos y ayuda al soporte suprarrenal, con problemas de estrés. Y estaba leyendo que en research que los padres autistas tienen el mismo nivel de estrés que una persona, que un militar en la guerra. I was just telling them that the autistic parents have the stress levels as high as military in war.
Yeah.
Así es que es algo que tenemos que darnos cuenta, identificar qué tanto estrés tenemos, porque el estrés que tengamos nosotros también lo reciben los niños. The kids can perceive it,
Mhm.
and we have to start sometimes with ourselves. Tenemos que empezar con nosotros mismos.
Ah,
Doctor,
sí.
quiero que nos quiero que nos ayude a, mm, quiero que nos ayude a buscarlo, a que nos dé información sobre su compañía
Ujú.
para que nosotros podamos seguirlo. Yo sé que muchas de la información que tiene usted está en inglés y voy a hacer en Spectrum Parents Academy esta información se la voy a dar a usted, para que también le ayude a los padres que hablan español, que por algún motivo lo encuentran en Facebook.
Sí.
You can do your page.
Oh, um, acompáñenme, ¿sí? Ahí.
Acompáñenme.
Ok.
Ajá.
Ok. Acompáñenme. Acompáñenme. No. ¿Cómo?
Acompáñenme. Ñen.
Acompáñenme.
Ajá.
Ok. Acompáñeme, doctor Skowron, en mis transmisiones en vivo en Facebook a través de la página spectrumawakening.com. En estas sesiones respondo preguntas en tiempo real, comparto estrategias de tratamiento y explico cómo apoyar el desarrollo de sus hijos desde adentro hacia afuera.
Ujú.
Consejos prácticos, ciencia real, comunidad que apoya, actualizaciones semanales y preguntas en vivo.
Sí,
Sí. ¿Es todos?
sí. Es una forma de que el doctor Skowron tiene para conectarse con la comunidad y ah, su información la tiene en vivo en Facebook todos los jueves
Ujú.
a las Thursdays a las 10.
Sí, jueves a las 12 y cuarto.
A las 12:15 en Facebook. Así es que si lo siguen en Spectrum Awakening, ahí van a poder encontrarlo todas las semanas. También tiene un podcast que se llama Spectrum Awakening. Y ahí la información que tiene en Facebook también la puedes encontrar en el podcast.
Sí.
Y es exactamente lo que tiene en Facebook, pero ahí lo puedes encontrar ah, en una lista con todo el contenido que tiene.
Y Instagram también.
Oh, y también tiene en el Instagram, en Spectrum Awakening.
Ujú.
Muy bien, gracias. Gracias, doctor, por esta entrevista. La verdad que le agradezco mucho su tiempo, su esfuerzo al hablar español. Se me hace muy lindo que haga este esfuerzo, no solo al ayudarnos a entender qué es el autismo, pero también darnos su tiempo para poder aprender y saber que hay muchísima gente como usted que está a un nivel muy alto de educación y su apoyo es incondicional con la comunidad y me da mucho gusto que tengamos este apoyo y que otros padres puedan ver también que no estamos solos y que buscando podemos encontrar soluciones.
Gracias. Y gracias a todas las papas. Yo quiero ayudar todos los hijos con autismo. Y gracias por la paciencia. Mi español no es bueno.
Vamos a seguir practicando, doctor.
Sí, sí, más práctico.
Más práctica. Gracias.
Gracias.
Okay, we can stop here. I'm gonna stop it and let it process.